Thank you, Jason, and thank you everyone for the opportunity to speak this morning. So as Jason mentioned, I'll be talking about system science, the next frontier for food, nutrition, and health. And let's see. So starting with some disclosures, we received a number of different grants from the NIH, including NICHD, as well as we have a contract with the National Heart and Lung and Blood Institute. And our GOPC, which is the Global Obesity Prevention Center, is a university-wide center that's headquartered at the Johns Hopkins Bloomberg School of Public Health, but includes all the different schools and departments throughout the university, including the Carey Business School, the School of Engineering, and the School of Medicine as well. And then we have a number of different projects across the world, and an administrative core, system science core, and an education and training program. So that was a quick overview. So this graphic over here, we like to use this for, if I can find the pointer. Oops, maybe I'll just, the right button? Okay, I don't quite see it, but I'll gesture towards that direction. So this schematic over here that we use for global obesity really can apply for all food, nutrition, and health. Essentially what we're trying to show here is that there are a number of different systems that impact food, nutrition, health, chronic diseases, obesity. It's not just a single cause, single effect. It's not just a single factor. So you have a variety of different biological factors. You have a variety of different social factors, behavioral factors, economics, policy, environment, all these different things. So to really understand and improve food and nutrition and improve health, you have to really address all these different systems. So Stephen Hawking is a very smart guy, obviously, and he made a statement, I believe it was about a year ago, that was at the same time a very good statement and also maybe not so good statement. He said that the obesity epidemic is the #1 major problem facing our world, which is great, but then he continued, but fortunately the solution is simple, and that's when everyone sort of stepped back and said, oops, because it's actually quite complex. So this is a paper that we published in Nutrition Reviews, really showing, if you really want to address nutrition and food and health, you really need to address all these complex systems. What exactly is a system? Well, a system is a collection of components and parts that are not independent. They're actually interrelated. So all of us are parts of a system, whether we realize it or not. Each of us consists of a system. We have biological systems and physiologic systems within us. And when you don't really address these systems or understand these systems, a number of problems can occur. So one is you use Band-Aids rather than solutions. In other words, you try to patch problems or cover problems. You have unsustainable solutions. You might miss secondary and tertiary effects. You have unintended consequences. Potentially, you have an intervention, you might have an unintended consequence. You also might miss the positive effects that an intervention or policy might have, and you expend considerable time, effort, and money and resources from trial and error. So I wanted to quickly go through this, since I did talk about this during a meeting, I believe, about 1.5 years ago. But one of the things we're also seeing is this advent of big data. So this is the definition of big data: high volume, high variety, high velocity. This really gives us a lot more opportunity to really better understand these different systems that we are immersed in. And so there's a variety of different big data processes that have emerged, including ways of managing big data and analytics. I won't go through this in great detail because this is not a big data talk, but I wanted to point out that there's different ways of looking at or using big data. So one is these top-down approaches where you look at these trends, these associations. These are examples of big data approaches, but the problem with these top-down approaches is you look at these general associations, these general correlations. For instance, coffee makes you live longer. That's an association that was shown in a couple recent studies in Annals of Internal Medicine. But is it really coffee that's doing it? What about drinking coffee might contribute to that? Could it be the antioxidants? There are all these complex systems that might be at play. And a top-down study can suggest associations, but it really doesn't show what's actually happening from a cause and effect. So what we like to do is we like to try to build up the system. So we use these so-called bottoms-up approaches where we recreate all the mechanisms that are involved in a given system, and in doing so really try to understand the cause and effects and how these different things might interact with each other. So there's different examples of systems approaches. One is systems mapping, which essentially is saying, okay, let's draw out or map out visually the different components of the system and how they affect each other. Examples of this are social network analyses, causal loop diagrams. And then once you've mapped out the system, then can you create a representation of the system, for instance, a computational model that can really represent the system, and then you can use it as a virtual laboratory to test different possibilities. So I'll be focusing on these two things, systems mapping, systems modeling, particularly systems modeling. Whenever we do modeling, we always do a systems map first. But in essence, with the advent of big data, you really have a lot more information, a lot of data that you can use to then populate and calibrate these models. So let me give an example of some of the models that we've developed to help understand these systems. So as all of you know, there are many other different complex systems in many different industries and sectors. So we've really seen systems modeling transform a lot of these other industries. So if you think about transportation systems, manufacturing systems, the weather, even sports, there are many examples of computational models that really have changed decision making. So if you think about, for instance, a weather map, whenever you look at a weather map, that essentially is a simulation model. It takes these diverse different streams of data, such as barometric pressure, such as temperature, what the tides are doing, terrain, and unifies it in a simulation model to produce what you see in the weather forecast every day. So you see that map, but that's basically just a visualization of what the model is showing and what the model is predicting. So if you try to think about back in history and try to imagine what it was like prior to the advent of weather maps, prior to the advent of simulation models, how could you figure out what the weather is going to be in the next week or month or even the next few hours? So maybe you could look at the sky, you could look at the moon and the clouds and those things like that and ask the cows. But you really can only make very gross predictions of what's right in front of you because you didn't really know what was happening. There are all these diverse data streams, and how do you connect all those different things? Now we take it for granted. We like to make fun of the weather forecast and say, well, it's accurate to some degree. But the accuracy is quite remarkable if you think about it when you compare it to maybe 100 years ago. And there are many other examples. Air traffic control is another example. In order to coordinate all the flights and the planes that land on the various different airports, not just within our country, but across the world, that's very challenging. And without a computational simulation model to predict where a plane is going to be going in the next few minutes, you'd have a lot of disasters occurring. So when I talk about computational modeling, I don't mean the left, I mean the right. I'm basically taking a computer or a whiteboard or a set of equations and trying to represent a system. And I want to emphasize that modeling is not a replacement for other types of studies. I call this the Skynet concern. Are you guys familiar with Skynet, which is the antagonist in Terminator? These computer models are not supposed to be self-aware models that will ultimately take over the world, at least not right now. But essentially, they're there to help decision making. Ultimately, decision makers or people make these decisions, but models can help facilitate those decisions. And they essentially can take a need or idea and help design and develop a retrospective study or plan a prospective study. They can also fill in the gaps. Like for instance, say you do a study in Los Angeles and you want to know what might happen if you do the same thing in New York City or London or Las Vegas or Tokyo. Rather than repeating those studies in every single location, if you create a computational model, you can see what might happen under changing circumstances. Similar with prospective studies, we know that there are issues with generalizability and study population, but in addition, they can be quite expensive, and they can also, you can run into ethical issues. If you're trying a natural experiment or you're trying a prospective study where potentially there might be harm to different individuals, then you could potentially use a simulation model to overcome some of these challenges. And of course, translating these analyses to policies and practice. I also want to emphasize that in all cases, a true systems approach is really an iterative approach. So you don't disappear, you don't say, okay, I'm going to develop a model, you disappear for 6 months inside a cave and then reemerge with an answer for everyone. Instead, this is supposed to be an integrated process where essentially you are developing initial models, and those initial models can help elucidate important factors and relationships, help prioritize data collection, so it can show you what data you have and what data you don't have. You can test different policies and interventions, you can inform stakeholders, you can design and implement interventions or changes, and that generates more data and results, and then that helps you update the models. This is very similar to what happens to each of us after we're born. So when we're born, we have these very simple mental models in our head. So we know a few things, like we know how to cry and lay around. But then as we get older, we start assimilating evidence and information. So we look over and we said, okay, stove, that's hot, don't touch that. And then you update your mental models. So that ultimately it becomes instinct. Whenever we talk about instinct, that's really your mental models running very quickly. So you know, okay, I'm not supposed to run screaming out of this room. Well, and that's from sort of your mental model understanding, okay, I probably shouldn't be doing that. So in the same way, you're updating these computational models, and they're getting better and better along the way. So you don't want to aim for the perfect model at the very beginning. So let me give you a couple examples of these types of models. So first, we call VPOP, Virtual Populations for Obesity Prevention, which is similar to the word K-pop. These are basically SimCities for obesity prevention. So we're developing simulation models of different cities and communities throughout the world. So examples are Baltimore. We're working with the New York City Health Department to develop a simulated model of New York City. We've developed one of New Orleans, and we're in the process of developing one in Washington, D.C. And we're also looking at other international cities to do that as well. But they're essentially representations of all the key elements that are relevant to diet and physical activity. So these include the entire population within these cities. So each of the people within these cities are represented by these computational agents, and each of these agents have different characteristics. We also represent the households, food sources, workplace, schools, and physical activity locations within the city or community. And as I mentioned, each person is represented by a computational agent, and just like a real person, each agent has a set of characteristics like an age, a gender, race, ethnicity, socioeconomic status, home assignment, school assignment, if they're children, work assignment, if they're adults, height and weight, and all these different things. So also within each of these agents is a embedded metabolic model. So this was developed initially by Kevin Hall at the NIH and has since been adapted, but it basically takes what the caloric intake and all the nutritional intake is for the individual, and then also the caloric expenditure through physical activity, and then converts that into changes within the body, like changes in weight. We've also incorporated CDC growth curves, so the children over each simulated day and each simulated year will grow taller, and hence their BMI will change. So what they do throughout the day will then determine whether they maintain the same growth curve or it will push the growth curve up or down depending on their energy balance. So each day, each of these virtual people, just like real people, wake up and then they go through their daily schedule making a variety of different types of decisions. So for instance, they may wake up and they say, okay, should I eat breakfast? Either they say, okay, no, I'm not going to eat breakfast. Or if they do eat breakfast, they have to make a decision. Should I eat it at home? Should I eat it along the way to where I'm going? For instance, if I go to school, or should I eat it at school? And then they make these decisions, like, for instance, if it's a weekday, should I go to school? And if I do go to school, should I walk to school? Should I take a car? Should I be airlifted? All these different potentials. And each of these things have implications. So depending on what you eat, where you eat, You're going to ingest a certain number of calories, and you're going to ingest a certain number of different types of nutrients. And if you walk to school as opposed to be carried to school, then you're going to burn a lot more calories. So throughout the day, they're making different types of nutrition and food decisions, and they're also making a number of different caloric and physical activity decisions. Okay, so let me just show you a visualization of this, just to give you a sense of. Okay, so you can see that this visualization is scrolling through the different, zooming in and out of Baltimore, just to show that you can move around. We actually have a synthetic population of the entire United States, so if we wanted to develop a model of any location, we could do that. And essentially, within this map, you have different key locations marked out, and each of those locations have different characteristics. So here's a park, and this park has a baseball field, and this is this size and this location. And each of the different food sources also has a number of different characteristics. So, for instance, a corner store might have particular stocking patterns. That's going to influence what the kids will eat. So if a kid stopped by at a corner store, and there's a certain distribution of food, then that child is more likely to choose different types of foods as opposed to another store which might have a different distribution of food. Now you can see representations in this case of some kids moving around. Each of these kids are by coincidence shaped like donuts, but the blue ones represent males and the red ones represent females. And then they're traveling to school in different places. So what they do is they essentially choose the fastest route to go from where they want to go. And when they pass by certain locations, they have a probability of actually entering those locations. So for instance, if a child is walking through a neighborhood with lots of corner stores, then there's a potential probability of that child stopping by one of those corner stores. More likely the closer one, but it's like an expanding probability. So you have lower probability of going to a further one, but you still do have a probability of going to that further one. And then they will choose food, et cetera. So then over time, we can track different measures, like for instance, BMI over time, and see what happens. So let me give you some examples of some uses of this model. So for instance, this is an example of using the model to help support decision-making, policy-making. So a couple years ago, the Baltimore City Council member Pete Welch sponsored a bill that would provide tax credits to any landowner or lot owner who would establish an urban farm. So if you have an empty vacant lot and you establish an urban farm there, then you can get a 90% tax credit. So a lot of people were interested in, well, what's the potential impact of that? You know, the challenge is you can do a study, but that would take years. So you could take 2 decades to do a study, and 20 years later you have your answer, and that's far too late. So instead we simulated what would happen if you established urban farms to varying degrees throughout Baltimore. And this helped inform some of the policy making. This is a picture of Joel Gittleson, who's a faculty member in our center. His back is towards you. And he is providing a testimony and showing some of the results to the city council. And on the left is a policy brief. So this just shows some examples of what's the conversion rate for vacant lots to urban farms, what's the impact of consumption of fruits and vegetables among adolescents, and then we also tracked what would happen to different health measures such as obesity and chronic diseases. And this is a news story showing that the urban farm tax credit passed. So certainly there were other factors, but it seemed to be helpful for them to actually see what the results might be over time. Another example is this was a study published in Health Affairs where we looked at the impact of increasing kids' physical activity throughout the entire United States. As many of you probably know, we're facing a bit of a physical inactivity crisis, especially among youth. If you look at some of the measures, so for instance, the percentage of youth that meet the minimum requirements as specified by the sports and fitness industry of 3 days a week, 25 minutes each of those 3 days of moderate to vigorous physical activity. That's less than a third of youth throughout the entire United States meet that minimum requirement. And it's actually not too hard to meet that. If you look at some of the surveys, there was one survey that I saw where they asked kids, have you played sports once over the past year? And I think something like 30 to 35% of kids said no, they had not played sports once throughout the past year. So we simulated the impact of increasing physical activity to different degrees among different populations, and we were able to show what's the impact on direct medical costs, what's the impact on productivity, losses, and all those different types of things. And all these numbers are well into the billions. So let me give you another example of another type of systems modeling project. This is our HERMES project, and in this case, we are building simulation models of supply chains, so different types of food supply chains. So I wrote a piece in The Guardian which really looked at the importance of food delivery and food distribution and supply. And as we know, there are many different types of food supply chain structures. They can be quite complex, and many times in many cases, it's not even well understood exactly where does food travel after it's left the farm or if it's left a producer. And so essentially, we've been developing a software platform that can create computer simulation models of different types of supply chains. So we actually started off, so it's called HERMES, which stands for Highly Extensible Resource for Modeling Event-Driven Supply Chains. One of the key things with a project, the most important thing with the project is coming up with a name. The actual project is secondary. But we're developing this software tool which you can input different types of data, and then you can generate this discrete event simulation model of the supply chain. And using that, that can serve as a virtual laboratory to basically test what's the impact of introducing new products, what's the impact of changing conditions or situations, where are the vulnerabilities, what happens if you use new technologies, how do you optimize food supply, and then what's the impact of different types of threats, for instance, to the food supply system. We actually started off in 2007 looking at vaccine supply chains, immunization supply chains, and then this is just an overview of some of the work in which we've worked with a variety of decision makers, different types of governments, the Gates Foundation, WHO, Gavi, including the leadership of the Gates Foundation. And we've gone through different countries and helped improve their, or identify ways to improve their immunization supply chains, ranging from what's the impact of introducing new vaccines to what's the impact of introducing new technologies like using drones to fly different medical products to different locations. And then we've also worked with different countries, including Benin, to improve or redesign their health product supply chain. So this is a visualization of supply chain in Benin. There's the map of the Benin. Each of these columns represents the inventory, in this case, of vaccines on a given day. So you can see the columns going up and down based on their daily inventory. And when they turn red, that's when you start hitting capacity. You start hitting maximum capacity or going over capacity. And each of those lines that shoot between the different locations is a transport occurring. So this is, again, a visualization of the supply chain where products are moving down the chain all the way to the population. So we can use these things to really identify where the vulnerabilities might be. And then we work with the Ministry of Health to redesign their vaccine supply chain. So we're doing similar type of work now with food supply chains. So in a food supply chain or a complex system, one of the challenges is, where do you intervene? If there's a problem getting food to populations, where exactly is the problem? And many times it's multiple locations. Or even if there's not a problem, how do you actually improve the situation? Or what's the impact of changes? We all know that populations change. We all know that food supply changes, farming may change, technology may change. So it can be quite complex when you're trying to really understand the interactions of these different factors. So essentially what we do is we create these virtual representations of all of the entire supply chain, all the way from the beginning, which may be a farm, which may be a production facility, which may be location if you're talking about fish, a fishery, et cetera. And then we represent each of the personnel, all of the equipment, all of the locations, all the routes, involved in getting that food all the way down to the population, including computational representations of the demand of the actual population and their nutritional requirements. And then there you can basically test different policies and interventions and see what the impact might be. So, again, you can help understand the key drivers of the system. You can diagnose resiliency and vulnerability to various types of shocks to the system. So that ranges from human-made shocks to shocks from nature. And also you can virtually test the impact of introducing new or existing technologies, and that includes new types of food products and behaviors before you actually implement it in the real world. Even after you've implemented it in the real world, you can use this to really understand what the system-wide effects are. So those are just some examples of the questions that you can ask. So I want to give a shout out to our system science core team. This is a collection of people from many different backgrounds and disciplines, including computer science, engineering, biostatistics, epidemiology, nutrition, health, all these different areas that basically help construct each of these different models. So these are just two examples of the computational models that we developed. We also are developing models of individuals, different people, schools, and other types of locations. And that's just examples of some of the work that we're doing. So in summary, food, nutrition, health, diseases are linked in this complex system. If you really want to tease out or understand the complex system, it's very difficult to do unaided, because as humans, which I'm assuming all of us are humans, we can see one step and maybe two steps. We can see, okay, what happens if I push this object, what happens? But seeing to the third or fourth degree, that gets more and more complex. So we need these aids, we need these assistants to really understand these systems. So we feel that this can transform the way we really understand and address dietary patterns, health, and diseases. It can really fully harness this growing body of information and knowledge and data that we have. And want to emphasize that, again, systems approaches is using these systems methodologies, but it's also changing the mindset in the sense that it's really bringing together different types of disciplines, different types of methodologies, working together iteratively with stakeholders and decision makers to really develop these models to understand and really address these systems in an improved way. So with that, happy to open up the floor to discussion.
Thanks, Bruce, and thanks to Heather and Bruce. We're back on time here, so we have time for, I guess, a couple quick questions.
Hi, I'm Catherine McMurray, NHLBI. This is a fascinating presentation. I have one comment and one question. One other comment is that the physical activity guidelines for children are actually 60 minutes per day, so the situation is even worse than you reported.
Yeah.
The question is, in your modeling of food, activity, the map that you showed, it appeared that you're tracking calorie intake for food, and I wondered if it's possible to look at the types of foods eaten, or at least the macronutrient content too. I understand it's very complex already, but it would be great if you could go into a little more detail at some point.
So good point so we also looked at the CDC guidelines, which are for physical activity, which, as you mentioned, are a higher bar. So we started off with lower bar and higher bar, and that's, if you can actually meet the CDC guidelines, the savings are even more. So thanks for pointing that out. Certainly, so we started off with just pure calories because that was simpler. Not simple, but it was simpler. But we are adding those other things like macronutrients. A big part of it is then figuring out what the pathways are, the mechanisms, and how they ultimately will affect health. So one of the things that we've done with each of these individuals, we'll have a model that then, as they age, will project what might happen to their chronic health status. So for instance, we've used combinations of like the Edmonton scoring system and some other systems to create this chronic health stage where the first stage is basically you don't have chronic disease, the second stage where you have early chronic disease, like you might have pre-diabetes or slightly elevated blood pressure, and then it progresses all the way down to where you have significant chronic disease. And in each of those cases, you then have probabilities of developing different types of clinical outcomes, like a stroke or developing diabetes or having a cardiac event like an MI, et cetera. And then you have attached costs and potential mortality from each of those things. So we started off, that was initially driven largely by BMI, but then we're introducing some of these other nutritional factors as well.
Great, thank you.
Hi, Susan Roberts from Coca-Cola Company.
Mm-hmm.
Thank you. This is very encouraging that we're moving in this direction. My question relates to the fact that you're trying to harness the complexity, which is what we need to do.
Mm-hmm.
But how do you decide on what elements to incorporate into your model? Because I just remember a few years back, the UK government sponsored the Foresight report.
Yeah.
And when you open that spreadsheet,
Yeah.
it's just hugely complex. And so you're starting to get a grip. Can you help us understand how do you decide what to put into your model?
Mm-hmm. So good question. So many of you have probably seen that diagram of the Foresight map, and it's impressive. So people use it on slides to say, oh, it's complex, and then it looks like spaghetti, basically. You've got all these lines there. What we found many times with these complex systems is actually representing the complexity and understanding the complexity in some ways simplifies it, because you identify actually what matters and what doesn't matter. So the Foresight map, while it's helpful to show that there are all these different factors, it really doesn't prioritize and doesn't really show that, okay, well, these things are very important, whereas these are less important. So what we found is we do go through a lot of time to map out what's there and then to build the mechanisms. But then when we actually start running the simulation models and we do sensitivity analysis to very different factors, invariably in many different systems, there are certain things that come out as really the key factors. And then you find that those are the large drivers. And since it's a system, you have this cascade effect. So if you do certain things, and then it can disseminate. I can't guarantee that will happen with every system, but it frequently does. So certainly there's a lot of upfront work to really sketch out all the different mechanisms and then to put it into the model. That's why these models can be very large and very computationally expensive. But then ultimately you start finding that there's certain factors that fall out. And we also can help identify win-win situations which you might not see immediately. And I think that's one of the keys here, where you can identify win-win situations where different stakeholders can actually benefit. We all know that different stakeholders come to the table with things they need to pay attention to. So certainly businesses need to pay attention to how they're doing financially. Policymakers have to understand what's happening with the population, food and nutrition experts, et cetera. But we've actually found situations where everyone can actually benefit because you are satisfying each of the different sectors. But those are very hard to see without understanding the system. Because ultimately then everyone defaults to, well, there's a limited pie and I need to get my piece, et cetera. So we've seen that benefit in many cases.
All right. Well, thank you, Bruce.
Okay, all right, thanks, Stacey.